The New York Times, an op-ed recently claims the Republican health care bill is an insult to women, saying this: if it becomes law, it will harm millions of Americans, including the poor, sick, and elderly. But it will be especially disastrous for women. Is that really true? Here to separate fact from fiction is radiologist Dr. Nicole Saphier. Good morning, Dr. Saphier.
Good morning.
All right, so let's go through some of these things that are mentioned in the article and find out if they're fact or fiction. So is this a myth or is it fact? Women's health is in danger under the AHCA.
These scare tactics on women are criminal, and they really have to stop. Under the AHCA right now, one of the concerns is essentially no federal dollars will be able to be used at Planned Parenthood across the nation on any services, cancer screening, wellness exams. Now, what this means is, in a lot of rural America, Planned Parenthood is actually the only place that people go for women's visits and get their cancer screenings, their pap smears. So this is concerning. Unfortunately, abortion services and Planned Parenthood are synonymous in most family households, and that's a fault of Planned Parenthood. They needed to separate their women's exams and visits and all of that from abortion services, and that would avoid some of the religious and emotional discord there. What we need to see in the Senate is what they're going to do with this. There are three things that can happen. Business as usual, which is not going to happen. You're not going to be able to convince everyone to give funding to places that have abortion. Do we separate them? Do we have a separate Planned Parenthood, maybe under a different name, where they don't perform abortions, but they still provide the great services they provide? Or are we going to spend millions of dollars to build these new centers completely separate from Planned Parenthood? And I'm not sure that's the fiscally responsible thing to do.
Maybe that's a great compromise, because there's so many taxpayers that don't want to give money to Planned Parenthood for religious reasons. They don't want to support abortion. So maybe that would be a great compromise.
Right. They need to separate the services.
Yeah. And is that not happening now? Have they talked about that?
They do offer different services at different types of locations. However, they need a much larger separation if they're going to convince bipartisan support to give funding to these centers.
Okay. The next topic is all who received coverage under ACA Medicaid expansion will lose coverage, according to this article, under the AHCA. Is that true?
Well, all generalizations are false, including this one. People who have already received coverage under the expansion are not subject to losing coverage. It's not going to just be pulled away from them if they've already gotten the coverage. The people who are going to be most in jeopardy are the able-bodied adults without children who are actually able to work. Now, that doesn't mean their coverage is going away. They're going to be given money still. However, they may see work requirements. They may have small premiums. They may have some deductibles, some co-pays, because everyone needs to give a little bit. We have to cut Medicaid expansion. In our last administration, our federal deficit was record high. The current administration has to do something to correct that, and a part of that is going to be less Medicaid funding.
Okay, the next topic, the next thing that they address in the article is essential health benefits are no longer covered under the AHCA. Essential health benefits. That sounds like a myth to me.
It's false, and you know it. The federal law actually still requires that we cover them. In the waiver states, you're going to see more coverage options. We're going away from, in this form, in the current form, we're going away from the cost sharing. A lot of people had complaints about that under the Affordable Care Act. They didn't understand why they had to pay for someone else's maternity care. And these waiver states are actually going to be addressing that. So less cost sharing. They will be able to buy plans that are pertinent to their family's needs.
It's so confusing. It would be great if you had a number to call, because in every state it's different. Every person's situation is different. You can't just put a broad stroke or blanket statement over everything, because every situation is different. So it'd be nice if there were a phone number you could call and say, this is my issue, what's going to be covered, what's not.
That sounds like a great business plan. I think you should do it on the side.
All right. Thanks so much.
Thank you.
Dr. Saphier, great to see you.